Ask the Messenger's TV show is a TV show that educates, informs, and entertains our viewers on public health issues such as mental illness, suicide, addiction, illness and disease, COVID-19 relief, crime, domestic violence, homelessness, human trafficking, employment opportunities, healthcare, and more. And now, Ask the Messengers.
Today on Ask the Messengers, the month of June is Men's Health Awareness Month, and we bring you some information that we hope will encourage men to make sure that they are in good health, not only during this month, but all year round. Plus, in our Doing Business in Detroit, we feature Rita's Italian Ice and Frozen Custard and the Jamaican Pot. Also, we bring you more amazing stories about how Detroit's Project Clean Slate is helping Detroit residents who once had felonies get their life back on track. Ask the Messengers begins now.
I am kind of sandwiched between some wonderful people. Ms. Rose, who's this gentleman on the side of me here?
That's my oldest son, Yeshaya Cunningham. And I'm setting him up to take over the business.
This is a family-owned business, and they help the community. Now tell me, what are some things that you're most proud of you guys accomplishing here?
To be honest, like I love the way to see, I love how like I saw the growth of the business, like literally from day one. Because I've been with, I'm the oldest in the family, so I've been with my mom and my dad through everything, even though in Georgia. So like to see us come to Detroit and open up back in 2014 in August, and to watch like a few customers come in a week, and
right.
then to watch the next year we got 100
right.
customers coming in a week, and then now we got like 500 customers coming in a week, and now even this, sometimes the lobby's so full, people outside. This will be our 10-year anniversary. Mm-hmm. So that that's very special to watch the growth of the business from that day one aspect. Other than that, like I love the fact that like I learned a lot of culinary skills myself in my own life. I love to cook. Like I am the main griller in the restaurant.
Oh wow! Wait a minute, you're gonna be running it. You know how to cook the food, talk to the customers. That's amazing. Mm-hmm. Because a lot of owners they don't know how to do everything. You know that, right? Like a lot of owners they have a cook, they have a chef, but they work the business side, and they also some people aren't even like personable. And you're watching this business grow. So you saw your parents in the beginning with the idea. Oh my goodness, the motivation there. I just want to thank you guys for coming out, for letting us come out. I want to say, look, I'm in the middle here. I'm feeling really love this special. I'm about to try some delicious food that you guys offer. I'm so excited because although my dream has been to go to Jamaica, really, really go and experience the culture, I'm about to have a taste of culture right here. Yes, thank you so much.
The Jamaican Pot is Michigan's #1 Jamaican restaurant. The Jamaican Pot is the perfect destination for your authentic Jamaican meals, and they are home of the authentic boneless jerk chicken. Order online, www.thejamaicanpot.com, or just come on in, 14615 8 Mile Road at Hubble. They're waiting for you Monday through Thursday, 11 a.m. to 9 p.m. and on Friday and Saturday, 11 a.m. to 10 p.m. The Jamaican Pot, #1 Jamaican restaurant in Michigan.
My name is Artesia Washington, and I am a franchisee with Rita's Ice and Custard. #1, we offer Italian ice that we make daily. We make dairy-free options for those that are lactose intolerant. So really, you come here, you leave with a smile.
To get your ice cream custard happiness, stop by Rita's of Farmington Hills, 25836 Middle Belt Road in Farmington Hills. They're open from noon to 9 p.m., 7 days a week.
Hey there. June is Men's Health Month.
In the United States, men live about 5 years less than women. Experts say this is partly because men are more likely to go longer without seeing a doctor, and they're less likely to practice preventative health measures. Family medicine physician Andres Santiana has important advice for men to get and stay healthier.
Even from a young age for men, if you are healthy, feel healthy and are doing well, it's still important to at least see your physician once a year minimum for your physical. There's certain ages where we like to get some baseline labs, screen for different things.
Specifically, men tend to have higher incidences of cardiovascular disease and diabetes.
Men tend to have a higher both morbidity of having these conditions as well as a higher mortality from them, and starting at an earlier age in life.
2/3 of American men say they avoid going to the doctor for as long as possible, and about 30% report having no personal doctor or healthcare provider. Dr. Santillana explains why this can be a dangerous decision.
You might have a family history of some things that we need to keep an eye out for. So really seeing your primary, getting your physicals done, and kind of sharing your history and family history with your physician as well.
A survey by the Cleveland Clinic found that more than half of men said their health wasn't something they talk about. Dr. Santillana encourages all men to take an active approach to their own health.
While men might be at higher risk of developing some of these conditions, doesn't mean that you have to suffer from it. Early screening, having your primary care doctor, sometimes as easy as a blood test to tell you if you're at higher risk, and you can make those changes, lifestyle modifications, just to keep yourself healthy and prevent you from having those complications from it.
As a family physician, Dr. Sharon Dome has seen it all, including the difference between many male and female patients.
In general, men have more of a mentality of, well, if I'm not sick, there's no problem.
Bill Hayes says he can relate to that.
I think I was like a lot of guys, especially when I was younger. I would never go see a doctor until something happened.
And then something did. A pain and overwhelming fatigue he had never felt before. A series of tests uncovered a blood infection and also a life-threatening blockage in his heart.
Well, the doctor told me that I probably would have at some point just been on a golf course somewhere and just keeled over.
Thankfully, it was discovered first. Many health problems develop slowly over time, may have no symptoms, and can be prevented if caught early. That's why Dr. Dome says men of all ages should check in with their family doctor on a timeline that's recommended for them.
Don't wait until you have symptoms. There's lots that can be done, and it doesn't take a long time if you come in and see your physician and get assessed.
In the 20s and 30s, doctors will discuss immunizations, drinking, safe sex, drug use, blood pressure, vision and hearing tests, and testicular cancer. In the 40s, the risk of testicular cancer falls until age 60, but discussions around screening for prostate and colon cancer may be top of mind if there is a family history. Testing for diabetes, cholesterol, and high blood pressure are also important. By the 50s, colon and prostate cancer screening come into play for those at average risk, not to mention managing chronic health issues as they develop. Men aged 65 and older should also undergo bone density screening. Bill underwent heart surgery and now checks in with his doctor regularly. He recommends other men do the same and be honest about their symptoms.
Men have a tendency sometimes to think of that as a weakness. And that's a problem, because it's not a weakness. I want to be around longer. I got grandchildren. I want to see them grow up. So if my spending 2 hours extra with a doctor means that whatever I'm dealing with gets better or whatever, it's time well spent.
It's hard for men to come to the doctor. They're very shy about their issues. Men's sexual health, urinary symptoms are one of the main reasons men come to the doctor, and sometimes it's kind of late. It's important for men of all ages to visit a urologist. There's also health screening tools that men need to be aware of that can help prevent a lot of the upcoming life issues, especially if they're at risk with a family history of certain cancers and health diseases. Men in their 30s should be screened for testicular cancer, high blood pressure, and high cholesterol. Men in their 40s should be screened for high blood pressure, diabetes, high cholesterol, heart disease, and if they have a family history of prostate cancer, they should be screened for prostate cancer. Men in their 50s should be screened for colon cancer, and that's usually done via colonoscopy. They should be screened for high blood pressure, high cholesterol, diabetes, heart disease, testicular cancer, and prostate cancer. Don't wait. There's a lot of things that are preventative. They really should be proactive about their diet and health and come to learn about what they can do to help.
Without Project Clean Slate, there is no telling where I would be right now.
It gave him back his life, because once he got the felony, it seemed like life was over.
Being unemployed, being depressed, being a burden. Project Clean Slate helped wipe those things away. I can't say thank you enough. I am now able to work for a reputable airline. Detroit had my back, all because I live in Detroit.
Tell me what Project Clean Slate means to you.
Everything.
Now you had your slate clean. About that process, the process that you had to go through, about how hard was it? Did you have to be patient?
Hard is a bad word for that. It was very easy.
Very easy?
Yeah. It was very easy. I tell people when I, give them advice about it, I say, hey, make sure you got an email that you check often, and they're going to give you an app that they communicate with. They're going to walk you through their process. When it's time to go do your fingerprints, they're going to tell you when and where, what time to be there. And as long as you can just read the email and follow the instructions, you're all good. So you don't have to keep up with anything, is what I'm saying.
That's what's really important. And you have a lot of people out there with fear. Mm-hmm. It's fear behind this. Mm-hmm. Talk to our viewers. If you could tell them anything, somebody that actually has a record that is able to have it expunged, what advice would you give them?
Oh, by all means, do it. Do it fast, as soon as possible, right? Because even in telling my story, it's always emotional for me because I realize the scope of what I'm saying. I realize how big of a deal that is. It's like when you're talking in terms of, I mentioned being a foster parent to my nephew. My nephew was autistic. We had a tragedy happen that wound up with him at my house. I had the ability to help, right? But if I had a record, I couldn't, that kind of thing. And so, that when we kept him for about a year, but the point is that it's all of these small things that you look at and you'd be like, wow. And when you understand the scope of it, it's a really, really big deal. It's overwhelming sometimes to think about.
So, Mr. Dubose, you went, your slate was clean. Yeah. You went to get a job. Yeah. You didn't have to check that box anymore. Yeah. Tell me a little bit about what happened during this new job interview.
So, I came in and I think I might have mentioned that they said that I had to do a drug test and a physical and a background check, an extensive background check. And for that, I was just like, oh, okay, cool. I was like, all right, take as much time as you need, right. Spare no expense. Yeah, spare no expense, do what you need to do, right? So, but beyond that space, there was a time where I feel like I almost interviewed them to a degree because I asked a lot of questions in my interview. But there was a time that they decided that they liked me, they wanted me, you're hired. They had an offer already prepared. They slid the offer across the table. And I looked at it and I was just like, And so the guy was like, hey, well, what were you thinking of? And I was just like, what number did you have in mind? And I was, I wanted to come in around here, and so in all honesty, I didn't get exactly what I was looking for here, but I surely didn't get what was on the paper. And I was able to do that because I came in, like I said earlier, feeling worthy. I felt worth it because I didn't have that cloud over my head. I was able to come in and let my personality shine through and advocate for myself in that space, right? And all of those things was a big deal, and it was just like, wow. So, I left out of there. I got the job. I'm still working there. They just sent me to Ohio for training last week. I just got back in town, and I'm going back to Ohio next week. So
with Project Clean Slate, you can negotiate your own salary. You can negotiate. They wanted something that let me tell you, you were able to do that. Yeah. And here you are. I mean, you didn't have a cloud over your head when you went in. You were confident. You were able to interview them, and that's what this program does for you. So Project Clean Slate has changed your life.
Yes.
Amazingly. So on the count of 3, I want you to say, we are Team Project Clean Slate. Are you ready? 1, 2, 3. We are Team Project Clean Slate.
So tell us how Project Clean Slate, how did you find out about it, and what were some of the things you had to go through to get going?
Well, I found out about it on through the internet, basically, and the word of mouth in Detroit. So I went on the internet, checked it out, and I applied for it. The Clean Slate, and I had to
let's take the brain up.
Go to court virtual, and then once I had to go in person. And got it done, got my record expunged, and I'm happy about it. You know what I'm saying?
Awesome.
The
So if you could say something to someone right now who might be, worried or concerned about, that magic letter that stains your record, talk to someone and let them know about the program and what would you encourage them to do?
Well, I would like to say even for the guys that's older, but most definitely for the younger generation, if you have something like that that's stopping you from progressing in your, maybe getting a career or something like that, you should still apply because nothing beats a failure but a try, and having something on your record can really affect your life for a long time.
For sure.
Yeah.
So if you can sum up Project Clean Slate in one sentence, what would that one sentence be? I want you to look right in that camera and share that statement.
Oh, well, Project Clean Slate, they're awesome. They got me together, and it was years in the making, but I'm just so glad that I don't have to worry about a felony anymore, it being on my record, and they're awesome. Period.
All you viewers at Ask the Messengers TV show, it is Project Clean Slate. The city of Detroit is doing amazing things, and I want you to tell our viewers who you are and your role in Project Clean Slate.
Certainly. My name is Timothy Kenny. I am recently retired, but at the time that Clean Slate started, and for 6 years after that, I was the chief judge in the Third Circuit Court and was involved as one of the resources in trying to assist in making expungements quicker and simpler and less expensive.
Now, it's interesting because a lot of people, they feel like the judicial system is really hard. It's a lot of red tape. What did you kind of have to go through to get where you are now? I mean, for this project to be where it is now?
Well, there were a number of hurdles to jump over.
Yeah.
And as a judge, all of us as judges are obliged to follow the law. And we may not like the law. We may think that the law this is too long a process. But that's not for us to change. That's for the legislature to change. And that's exactly what happened. And I think things moved exponentially when the legislature decided to make it easier for people to get expungements and for certain expungements to be automatic for people. And that, along with the fact that the city officials and Project Clean Slate's team and the court worked together in terms of streamlining how we can get these expungements through a whole lot quicker.
So it's all these intricate details, all these families' lives that you're changing. What's one of the most rewarding things that you've not just seen here, but that you've seen while you've been basically having your role in this project? You're activist in this, right?
Well, I think the best part is having the opportunity to receive some of the comments that those who have successfully completed the expungement process have shared with Project Clean Slate, and a number of those responses and comments have been passed on to me. And it's very rewarding. I mean, it's not something you get in a paycheck, It's the fact that, you see that you have been a part of a huge team effort to improve not only the life of the person who's been successful in getting the expungement, but how that impacts in a positive way his whole family, and the sense of optimism that brings, and how it just gives people, I think, a new lease on life, because so many of these folks just feel like they're carrying this weight on their shoulders that will never go away.
So if you could give just quick advice with people that are apprehensive about the legal system and Project Clean Slate, what would you say to our viewers?
I would tell your viewers to run, don't walk, to make contact with Project Clean Slate to determine whether or not you are in fact eligible for expungement. If you are, They are the best resource in the state of Michigan to help you get your expungement and to help you open up the doors toward education and jobs and housing.
Yes.
And if it turns out you're not eligible at this particular time, well, then you'll get advice as to when you would be eligible. You really haven't lost anything.
You're right. You're right. I'm going to take a little soundbite from what you said earlier. On the count of 3, I want you to say with me, Project Clean Slate, a new lease on life. Are you ready? Sure. 1, 2, 3. Project Clean Slate, a new lease on life.
Well, that concludes this week's episode of Ask the Messengers. We also invite you to follow us on Facebook, Instagram, Twitter, and to subscribe to our YouTube channel. If you would like to help support our show, please feel free to make a donation of any kind by visiting our show website, www.askthemessengers.org. If you prefer to mail donations, please make check or money order payable to Ask the Messengers TV show and send it to 18400 Schaefer Highway, Detroit, Michigan 48235. Ask the Messengers is the program that deals with things that help you. Thank you for watching.